There's no one cause of Alzheimer's or dementia. It's really like if you think of it as like a leaky boat. And so that means there's no one solution. And so it's just a question of like which leaks would sink that ship, and what can you do to shore up the weak areas of your particular boat to make sure that you don't take on water.
Crazy.
All right, Adam Schultz and Ariana Myers, welcome to Startup Health Now. I appreciate you taking time with me and giving me this update on what you're doing with Mindr on the eve of what should be an exciting period of time as you enter into this new race. So Adam, Ariana, thanks for joining me.
Absolutely. Thank you for having us. We really appreciate the opportunity to tell our story.
Yeah. So let's get into that story. Adam, why don't you start with just giving me an overview of what Mindr is? When did you launch the company? What have the last, say, year or two looked like for you?
Kind of the whole, like, why do we exist? By most estimates, by 2030, there's going to be 50 million people living with dementia or Alzheimer's in the US. And that's pretty insane. And there's no real known cure. However, the Lancet Commission has made it really, really clear that if you can simply take control of kind of key modifiable risk factors or modify your life a little bit, there's a 50% chance that if you are at risk for Alzheimer's or dementia, you can prevent the disease. And so this is just a really great example of where an ounce of prevention is worth a pound of cure. And so we're trying to build a platform that can help people make the daily challenges, 5 to 15 minutes a day, to help them implement those best practices that would lead to and increase their chances of delaying or preventing the symptoms of Alzheimer's and dementia. Yeah, in terms of where we are now, started the company late 2021. Did a pilot project in 2022 to show that, in fact, the findings of the finger trial could be implemented digitally. The commission that did that report originally said that it was too expensive and too time consuming to deploy this at scale. But we had a pilot program that showed in just 90 days that in fact people would stay adherent. We had 5 to 15 minutes of activities a day. Delivered to folks' phones. We had 88% adherence over that 90-day period, and showed substantial health outcomes for the folks who had participated in terms of their number of healthy days, in terms of how they felt about their memory had improved, the likelihood of remembering recent conversations had improved, and so our goal now is to take that finding and build a platform to help people achieve this goal.
Okay. Ariana. Ariana, tell me a little bit more about your background, and then let's dive into the finger study Adam mentioned and kind of what makes it unique.
Sure. So if we go way back, I was an investment banker, but I took a hard pivot about, I would say 14 years ago, looking for something a bit more meaningful. And after climbing a few mountains, literally and figuratively, I would say, wound up repatriating from overseas back to the Bay Area, and really focusing since that time on health technology through the lens of an aging population. So that's my background. It's taken a lot of different forms. I'm a pretty hands-on person. I did start, build, run, and eventually sell a home care agency, which gave me a really granular view into the senior care continuum, all the stakeholders, their points of pain, the way the money flows, and the various aspects that are involved in senior care, and got really interested in neurodegeneration. Went back to school and did a couple of years research at the Buck Institute for Research on Aging in an Alzheimer's lab. So again, with the hands-on, just have kind of a 360-degree view around Alzheimer's, senior care aging, from both a scientific perspective and from a care perspective.
So you said you ran a home care agency? Okay.
I did.
So you were up close and personal with folks who deal with the exact issues that you're trying to address with Mindr.
Absolutely. Yeah, absolutely. Yeah, I know these folks well. And, we always had two clients, right? There was the person that was receiving the care, but then there was, the loved one, the adult child very often who was taking care of them. And so understanding everyone's needs and points of pain is a really critical piece of how we're looking at Mindr and kind of who should be interested in using it. Right.
Yeah. So talk to me about the finger study that is the backbone of the app or the product, and kind of why it's breakthrough, kind of why it's worthy of creating this entire company versus just sort of being another data point in the market.
Absolutely. So the finger trial then is a pun, well, Fin for Finland and GER for geriatric. So this was a seminal study that was conducted in Finland from 2014 to 2016. So 2-year randomized controlled trial, 2,000 participants. And the idea behind it was to take the research that had been mounting right up until that time, saying, hey, we know that a good diet is correlated with good cognitive health. We know that exercise is correlated with good cognitive health. What if we took all these different aspects of your lifestyle and combine them together? Could we achieve a statistically significant improvement in health outcomes versus a control? Obviously, you're not going to leave a control group with no intervention. So those folks got normal, regular health advice, medical advice. But then there was a participant group that received a personalized lifestyle program, and they had personalized interventions where someone was watching what they were doing and paying attention to what they were doing. And the results were astounding. They were very significant, and they really had an impact on the scientific world. So much so that finger trial was repeated in other locations. So they did it in Southern Europe, they did it in Korea, and we do finally have a version of the finger trial happening in the U.S. called the U.S. Pointer. It's going to be wrapping up later this year, and we'll see the results probably at the Alzheimer's Association International Conference next summer. So
is that another finger pun, the pointer study?
Yeah, oh, absolutely. Yeah, absolutely. Yep. Never waste an opportunity, right?
Never. You gotta spice things up. So Adam, talk to me about the specifics of the finger study and how they are incorporated into the Mindr product, kind of the different pillars.
Yeah. So the finger study really came across 5 key areas, right? So nutrition, managing medical conditions, physical activity, cognitive engagement. And so in each of these kind of key areas, they had specifically designed interventions to help people implement the lifestyle changes they need to change, they needed to adjust. For instance, it's advised that you be active, you have a heart pumping activity, right? At least on average, 15 minutes a day. That doesn't mean it has to be 15 minutes a day. If you're playing tennis with friends for an hour, right, that can kind of count as 4 days worth of activity per se. But they found that people who were meeting that key objective of on average 15 minutes of activity a day had decreased their risk of cognitive decline. And that's really what it's about, right? There's no one cause of Alzheimer's or dementia. It's really like if you think of it as like a leaky boat, right? And so that means there's no one solution. And so it's just a question of like which leaks would sink that ship, and what can you do to shore up the weak areas of your particular boat to make sure that you don't take on water. And so our program is designed specifically around those same areas. In the first week of our program, we're asking a lot of questions, trying to figure out which risk factors are and aren't relevant to that user. And then when they're then getting their interventions, they're only going to get the interventions that are relevant to them. For instance, someone who is already, like, let's say they're already pretty much eating the Mind diet or the Mediterranean diet. Well, we're not going to have a whole lot for them because that's exactly what's recommended. But if they're eating a lot of high cholesterol foods or they're eating a lot of high sugar foods, well, we're going to try to get them to eat more fruits and vegetables, right? But we're going to meet each person where they are based on what their needs are to help them shore up the holes in their particular boat. And that's kind of what our program does. It learns, it helps to understand what they're doing and gives them just the activities they need to help them shore up their boat.
Yeah. The solution seems elegantly simple. You have a great study and you're digitizing it, making it available. Sometimes that can be a challenge if people sometimes they want a pill. And if you give them an app that's like simple things to do, like to exercise, they might not understand how big of a deal that is. So any thoughts on how you overcome the inertia that can come along with these sorts of solutions?
Yeah, well, that's why our pilot was so important, right? We needed to show right out of the gate that people will do the things we ask them to do. And we created the pilot to achieve that. And two of the biggest things we're doing is number one, we're utilizing motivational interviewing in every part of what we do. So there's kind of, if you think about like the two different ways to motivate someone, on the one hand, you play up their intrinsic motivation, the things that are already driving them. On the other hand, you create new things to make them chase, right? This is like paying kids for grades, or if like you do Duolingo, right? Like, oh, I got to get in more time so I don't lose my place in the leaderboard. Those are all extrinsic factors.
Yeah.
With Mindr, we're leaning almost exclusively on intrinsic motivational factors. We're using motivational interviewing, personal commitments, and human accountability partnerships as the key component to drive engagement. So if someone's falling off track, if someone's not logging in, our human coach will actually call them and say, hey, we notice you haven't logged in for a few days. You told us how important this was to you, that you wanted to stay sharp and be able to see your grandkids graduate high school. We know that's a goal of why you want to stay sharp long into your old age. Let's talk about what's getting in the way right now. Oh, you hurt your ankle. Cool, no problem. Let's talk about ways we can modify your plan. Instead of having you on a walking track, we're going to change your physical activity over to swimming because you have a pool in your backyard. So let's make sure that you stay active, even though you have that foot injury. Like let's find a way to make sure that you still hit these goals, even though life's trying to get in the way. And the human accountability partnership is the key that keeps people coming back and keeps them engaged because they already want to do these things. We're just giving them something daily that they can do, 5 to 15 minutes. It's a simple commitment, and then a human partner to help them stay on track. And I know it sounds simple, but it's a lot to pull off, right? In terms of really making that plan wrap around the user. But it's wildly effective.
Wow. Hey, Ariana, what's the ideal age for folks to kick this into gear? I know an awful lot of people in my parents' generation in their 70s who haven't had a diagnosis of mild cognitive impairment, but maybe they're thinking about the next phase and whether their possible loss of memory, could be leading to something else. So it's kind of on their mind, but they haven't gotten treatment yet. So I'm kind of curious who's the perfect audience here?
Sure. Great question. So one of the things to know is that in the aftermath of the finger trial, there was further analysis that was done that demonstrated that your baseline wasn't actually important for your outcome. So if you were, no matter where you are, you can start. So there's no reason to feel like you're kind of too far gone to start living a healthy lifestyle.
Yeah.
And there's a benefit to that. At the other end of the scale, cognitive health is for everybody, right? And so there's no low threshold age below which you shouldn't be doing these important things. For us, we're really looking at, if we had a persona, if you like, we're really targeting kind of, 50 to 65. This may be a sandwich generation caregiver for somebody. Their parents have dementia, but they're taking care of family and can really use a kind of digestible format to take care of their own cognitive health, which is really top of mind, right? Yeah. Because they've got that in the family, or maybe you're worried, you have family members with that. For me, and for Adam and for the whole team, our vision is that this becomes standard of care, right? Lifestyle medicine is real and it's understood and it's accepted as an important thing. And for me, I want to see, you turn 40 and you go to your primary care physician and they prescribe Mindr and that just becomes part of your natural healthcare routine.
Yeah. Adam, let's talk about go-to-market strategy, because there's a lot of companies out there that would love to succeed at this holy grail of being the the platform that gets prescribed when you turn 40. And this is what you log into, and it's preventative health, and it really keeps you healthy going forward. So what are some of your thoughts on like the ideal partnerships, kind of what you have to do in order to get this into a lot more people's hands?
Yeah, I mean, ultimately, our end customer is going to be employers or providers or payviders. Like ultimately, in order to achieve our goal to make sure that absolutely everyone, regardless of background, social class, like how much we want everyone deserves this kind of preventative care. And the easiest and the fastest way to scale that is to make sure we've got a really solid third-party payer. And so the employee benefits providers, employers themselves, value-based care organizations, like these are the people that we want to meet, that we need to be that we're talking to and need to have more conversations with, because ultimately these are the people who are going to pay for this, to deliver this product to their employers or their members, to help make sure that those people are healthy. For the employers, they want their workforce to be healthy. They want them to be able to work as long as they want to work. For the insurance providers, they want to lower their cost of care. They want to decrease expensive events. And Alzheimer's and dementia is incredibly expensive. And so we think the business case is there. We just need to prove that, in fact, we're achieving really solid health outcomes in order to make that case. And so we're working on that now. The product is actually in alpha right now. We've got alpha users. We're getting feedback right now, this week, we launched it last week. And then we're hoping to be in beta come October, November, and actually be actively beta testing the product at that point. And so we're moving along. We're making our progress. But ultimately, the true scalability of the solution is going to come down to really finding those great customers.
Okay. So if you could wave a magic wand and have the right person watch this video and then contact you, it would be a large employer that cares about the health of their employees?
Sure. Absolutely. That would be fantastic.
And you're also, I mentioned at the beginning, you're starting a round, a fundraise. What's the timing of your current round?
Yeah. So similar timeline. We're really the hard push is next week. So September 1st is when we're really going to start pushing and working our timeline. We've been doing some networking this month, and we kind of did a soft launch. So we're already in process. But the hope is to close the round ideally before the end of the year.
Okay. Just, out of my own curiosity and putting the patient hat back on, Ariana, I'm curious, some of the things that the finger study talked about that Mindr works through are kind of maybe obvious, like improving your diet, physical activity, social connection. I'm curious, for patients, is there anything sort of less intuitive, anything that's sort of maybe surprising to them, like, oh, this is actually good for you and your brain health? Anything that sort of kind of strikes people as curious?
Well, the science is always moving forward, right? So we're starting with the protocols that were in the finger trial, but the list of sort of 5 areas of focus has expanded, and the most recent Lancet Commission report identified 14 different areas.
Okay.
So one of the things that makes sense when you think about it, but if you didn't know in advance, is that if you suffer from hearing loss, that can contribute to cognitive decline. But if you understand that having hearing loss means that you maybe participate less in conversations, or you're not able to hear the full gist of what's going on, then you don't have that continuous cognitive stimulation. So it's a kind of atrophying of your neural pathways. So that would be one example.
Yeah, that's good.
It makes sense, right? But not necessarily, you wouldn't necessarily guess it in advance.
Yeah. And how we're using that is we still have kind of our 5 main categories of engagement, our 5 main tracks, we call them in the app, in terms of how we build out our content and our activities. But when something comes in that was in something that wasn't necessarily in the finger trial, we're bringing in all the latest science. So like hearing loss is something we're going to add to manage a medical. Sleep is something we're going to be adding to manage a medical. These are things that weren't in the finger trial, but the science has come out since then and said this is really important. So even though our engagement is based initially on the findings of the finger trial and the approach that they took, we're integrating the latest science every day. And the way that we're building our product is going to allow us to do that and add new content, add new interventions, add new questions as we go. That will never be static. So we can always stay exactly up to date with the latest trends, the latest data, and the latest interventions.
And once you build that preventative health relationship with folks earlier and earlier, you can become their go-to even as they move maybe into therapies and move into other types of care. So
correct.
That's super valuable. Well, that's the time we have today. Adam and Ariana, thanks for giving me the update on Mindr. Really exciting to see you move into this raise, move into your beta. Excited to see the data that comes out of this and the kind of partnerships that can emerge. So I appreciate your update today.
Yeah, and we really appreciate all your support, you Startup Health. It's such an amazing organization, and we're so thrilled and privileged to be a part of it. So thank you so much for your support.
Agreed.
All right. Well, take care, be well, and we'll be watching for your next updates.
Thanks, Logan.
Thanks.
At Startup Health, we believe in broadcasting the stories of Health Moonshot progress, the stories of the most forward-thinking entrepreneurs in health. If you want more of this good news about healthcare's problem solvers, make sure that you subscribe to our channel, hit that notification button, and follow us on social media at Startup Health.